More than 2 years ago, we put forth a vision about a healthier America where we could have better quality care at a lower cost to many more people. With the passage of that legislation, we went down that path. About 2 weeks ago, the Supreme Court upheld the legislation. As I said to Anna and others earlier, I never had any doubt that we would pass the bill. I had never any doubt that it would not be upheld constitutionally because we believed when we wrote the bill, as we would write any bill, that it would measure up to the Constitution. In this case, understanding the scrutiny it would receive, it was ironclad, and we're thrilled that the court saw it that way. Today, 2 days ago in Washington, D.C., 2 years, 2 weeks, 2 days ago, we heard from people in their everyday lives what you hear from people in their everyday lives over and over again, what this bill means to them. We heard from Bill Sia, a retiree from Florida, originally from Baltimore, Maryland, who talked about how he is able to have lower cost prescription drugs because of the Affordable Care Act, and that's important to him. He's also able to have a free preventive and wellness checkup without any copay, any deductible, very important to seniors, and tens of millions of other people too, but very important to seniors. We heard from Christine Farley, a young woman who has 2 children, and one of them was born with cystic fibrosis, and what this bill means to her, that he will not be discriminated against because of a pre-existing condition and will not be subjected to lifetime limits on the health care he receives. And it's very costly, tens of thousands of dollars a year for a child, hundreds of dollars a day in medication. We heard from Emily Schlichtling, who's a young adult with an autoimmune disease, and her costs are exorbitant. Now she can be on her family's policy, and all the difference that that makes in terms of that policy and lifetime limits and non-discrimination. And Araceli Rodriguez, who talked about the impact on women, particularly Latina women. It was very moving in terms of her presentation. And also we heard from Jamali, a small business owner, and we'll hear more about that from David Chase today as to what this means to small business owners. And all of them talked about what they are enjoying and experiencing now. More to come as soon as August, certainly more to come when the bill is fully implemented. But in the case of small business, so nearly 2 million people will have access to health insurance because of small business tax credits already in effect. And all of that I talked about children, young adults, seniors, women, et cetera, already in place. But we'll be hearing more from our experts on the subjects. It was important for us on the day that there was a motion to repeal the bill on the floor, that people listened and heard what it meant to people in their everyday lives. It was very important. And you know, up to 17 million people will have this coverage, not be discriminated against because of a pre-existing medical condition. And that is many of them with diabetes, asthma, leukemia, any other pre-existing condition. And the list goes on. I heard someone on TV say about the pre-existing condition, oh, don't worry about that. That hardly affects anybody. Maybe this many people. Well, it's over 100 million people who are affected by that. And just imagine how many families and policies, if it's that many people, are affected. I'm not going to go into some of all of it because we're going to hear from our panel, but also your questions will direct where our focus will be. But I did want to talk about someone who inspired us as we were doing the bill. A young mom, her name was Stacy Ritter. She had twin daughters, Hannah and Madeline. After 4 years, at 4 years old, they were both twin daughters, both diagnosed with leukemia. Hannah and Madeline faced stem cell transplants, chemotherapy, total body irradiation. Over time, she said, we ended bankrupt even though we had full insurance coverage. Today, Hannah and Madeline are healthy, happy 13-year-olds. They came through it. And according to Stacy, my children now have protections from insurance determination based on their pre-existing medical cancer condition. They will never have to fear the rescission of their insurance policy if they get sick. They can look forward to lower insurance rates and preventative care. And some of the people will be getting rebates from the insurance industry because of a provision in the bill that talks about medical loss ratio, that insurance companies have to spend 80% at least of the money they collect on meeting the needs of their premium, their policy holders, not on CEO compensation and inflated administrative costs. I mean, that's why they're coming after us. You know, see, they spent $200 million putting out a negative message on the bill, misrepresentations, frankly, about the bill while it was in the process. That doesn't count what they spent in the elections, just what they did during the course of the debate. And now they're amassing another fortune they've already put up millions of dollars to go after the bill again. So it's really important for people to have the facts, and then they'll make their decision about it. It was interesting to me that the court came out the week before the 4th of July because it was a perfect way to celebrate the 4th of July, freedom in our country, the Declaration of Independence, because that's what this bill has always been about, honoring the vows of our founders in terms of life, liberty, and the pursuit of happiness. Life, liberty, and the pursuit of happiness. And that is life, healthier life, liberty, the freedom to pursue your happiness, to honor your aspirations, your talents, your skills, your passions, to be self-employed if you're a creative person, to start a business, to change jobs, and not have your freedom impaired and your career and life decisions based on whether you have a pre-existing condition in your family and you have to be job locked into a job because of health care, not be able to contribute your vitality to our economy, to our society. Again, your life, your liberty, your pursuit of happiness. So I thank all of you who made all this possible. I want to acknowledge Tim Paulson from the San Francisco Labor Council. Thank you for all that you have done. Rita Semmel, so many of you. I could name so many of you in this room, whether it's interfaith, that's the right term, right? Not ecumenical, interfaith. Rita Semmel, so Patty Siegel, many the children. But again, perhaps in the course of questions, we can acknowledge all that all of you have done. But please take satisfaction in what you have done for these children, for these young adults, for these women, for these seniors, for small businesses, for the aspirations of America to continue to be #1. It simply could not have happened without you. Thank you so much, and thank you, Annie Chung, for your hospitality.